And we do an EMG on a lot of the folks, and people often ask me why. And it's not because I'm interested in what's going on in a limb that has obvious polio. I mean, there's nothing to be gained from that. What we're really interested in are the limbs that appear to be unaffected. And the reason that I'm so interested in that is because I want to find out, does the person have any normal limbs? And if they are, then those are the limbs you use for exercise, because we try to find an exercise program for everybody. You know, and a very common example would be the person who basically had polio in one leg, or say both legs, but their arms have been, quote, normal for their whole life. And as far as they know, they are totally normal. But because you can have normal looking and normal testing arms, but still have what's called subclinical polio, I want to know that. Because if they do have, you want to, you know, the EMG is not a quantitative test, but, you know, you can see, is there a small amount of polio, is there a moderate or a large amount? And, you know, we are frequently surprised and find folks that think their arms are normal and they've got a moderate or large amount of subclinical polio. Well, knowing that, it just makes you a little more careful in prescribing a vigorous exercise program with their arms. Conversely, if you do a systematic examination of the arms and you don't find any trace of polio, then you can say, hey, your arms are totally normal. You know, your polio is below your belt. And use your arms any way you want. You know, generally we're talking about folks who are older, in their 50s, 60s, 70s, and, you know, lifting weights doesn't make sense, but what you want are cardiovascular, cardiopulmonary exercises, which means, you know, low impact, you know, endurance kind of exercise. So typically that ends up being with an upper extremity exercise. But the whole idea is it has to be tailored to the individual. And if somebody has shoulder problems, then, you know, it becomes more difficult to find something that they might enjoy doing that gives them a cardiopulmonary workout.
What would you say to a person that came in and said, look, I think I had polio?
What we would do, and they're having new symptoms?
Yes.
They may be able to post-polio syndrome. Basically, we would do an EMG test. If we did well, first of all, I would do a physical exam to look for any signs of previous polio, such as reduction or loss of reflexes, weakness, muscular atrophy. And if things weren't really clear, I would get in this case, I would certainly get EMG studies to look for evidence of previous motor neuron loss, typical of, you know, paralytic polio, but paralytic polio in quotes can also occur, and patients may not know, because there may be a subclinical loss of motor neurons. So basically we do EMG studies to look for subclinical loss of motor neurons. I mean, there's some people or investigators and think that people who don't have motor neuron loss and EMG studies may also get post-polio syndrome, but that's a bit of a discussion. So anyhow, if they do have signs of motor neuron loss and all the typical symptoms of post-polio syndrome, the main symptoms for post-polio syndrome, by the way, are new progressive weakness and muscle fatigue. Those are one of those two symptoms you have to have that diagnosis. So if they have the EMG findings and the symptoms, then we would say that they have post-polio syndrome. If they don't have anything else, that could be a sign. It's very important for patients with general fatigue also to probably be evaluated in the sleep clinic, especially if it's a significant problem for the patients. And if their fatigue is atypical for post-polio, I would really strongly recommend that patients be evaluated in the sleep clinic, just because you know, this is, if you do find sleep apnea, and these patients have primarily obstructive sleep apnea, that's what we found, not central apnea, it's treatable.
So, for example, especially individuals coming from Ohio, this is not uncommon at all, that if they would rather have the sleep study done here, then they might come in the evening before, stay overnight, not to pay for a hotel, and have their sleep study, and then see us in the morning, Friday morning. The option is always there to have the sleep study done locally, although at least here in the U.S., there are sleep clinics, study centers popping up all over the place, and you do need to be a little bit careful of the quality of where you're going and be sure that there's somebody board certified who's reading the study and things like that. But in addition to underlying sleep dysfunctions like sleep apnea or periodic leg movement disorder, which are both fairly common in this population, it's very common to see folks who just have very poor sleep hygiene, and they have a reason for not sleeping well, but then they develop behaviors that just continue to make that worse. You know, turning on the TV at night, using the computer at night, things to distract them from not sleeping, which then serve as a stimulus to be awake.